I think one top question is what we currently address, asking and trying to share it, cornea banks. What is their current standard? Do they test when they get recipients, when they get harvested corneas, do they test them for COVID or not? Is there a difference how they do it in Italy than they do in the Netherlands, in the UK, or in the US, where they're currently not testing at all? Will this change? Will we have a massive lack of corneas because of that? Because we are wasting so many right now. And whereas the US was for many years able to export corneas, probably in the next coming 12 to 24 months, they have a lack because they had to throw away so many of them. I think this is a key crucial point.
That is crucial. And I think especially because thinking back to, I guess, the 80s, 90s, I seem to remember there was concern around when HIV started coming up, making sure that the blood supply was not going to be infected. We're talking about corneas. Different issue, but still very relevant. Tell me more. What's going to happen with that?
Good question. What I tend to believe, there will be a big shortage. Many corneal transplantations, no matter if we're talking DALK, DMAC, DZAC, penetrating keratoplasty, are postponed. In the US, for example, they have a list of surgeries you're allowed to do as a surgeon, and all the others have to be postponed. And only if it's really critical, you would do it. So the cornea banks sitting on their corneas, they're not lasting forever. So if you ask me, whenever the whole thing is over and we're starting doing surgeries again in normal numbers in October, then there will be a competition between cataract and between vitrectomy and between corneal surgeons. So what I'm doing first in my clinic, and the shortage of cornea, this all accumulated will lead to relatively long waiting times, and it might take 12 to 24 months worldwide until this has recovered to a certain extent, I believe.
You know, we've talked to doctors all over the world. Some are still operating in emergency situations. Are there any emergency situations that would require corneas, but which may be infected with coronavirus at this time?
If you ask me, I mean, there are details enlightening that in each and every country. What is a surgery which can be postponed and what is considered being an emergency surgery. And this differs a bit from A like Australia to Z like Cyprus. But basically, probably if you had an accident, your cornea, it's immediate. We have to fix it and we might have to do a transplantation. Same if it is an accident with acid or whatever. We want to avoid going to the stem cells, we will have to replace it. And the third cases I know would be young children, growing young children. If they don't learn seeing, if they don't stimulate the optical nerves, they will be harmed in their sight forever. So young children, whether it's congenital cataract, whether it is the cornea, they would be probably treated to make sure they will have not a handicap for the rest of their lifetime.
Does that mean that, let's say, the corneas, we need to make sure that the cornea was quarantined for like 14 days before usage?
Not really. In Italy, we talked to the biggest cornea bank in Italy, which is in Venice, Mestre, and they are already testing each and every recipient. Each donor will be tested prior to accepting the cornea to make sure they are not having a COVID cornea. In the US, the regime is not yet. The FDA is not requiring it, but if you ask me, in a couple of weeks, probably other countries will adapt to the same scenario Italy is doing. They test each and every harvested cornea to make sure that the cornea is not a potential transmission of COVID-19 to the recipient.
Gosh, there are just so many implications of this, it seems like. I mean, right now, it's hard to even get a test for a person if they think they have coronavirus in the US. But you're talking about sort of an extension of that, testing a donor for a corneal recipient. It must get even more bureaucratic in some countries, at least, I would think.
Yep. And that's probably the reason why in the US they are currently not in a position to really test. If they would know the patient would have died in relation to COVID-19, probably they would not use the cornea. But currently they are testing for HIV and everything else, but they're not testing for COVID-19. It's really weird. And on the other hand, we know that the United States used to be the biggest worldwide exporter of corneas, which will not be the case in the near future anymore.
I was just reading an article about that very fact, that there may be certain things, maybe corneas in the future, which will take a step back from globalization, that there may be countries that want to simply keep that sort of in the nation as a protective supply of biotypes of, what I guess you could call it a sort of an organ or something like that, right? Almost like an organ transplant. So therefore, to protect the population in times of crisis.
Many did, but especially Italy and the US, because they have a different regime, they had an excess of corneas. And I think it's from an ethical point of view, if you're having an excess of donor organs, whether it's an eye or whether it's kidney, heart, whatever, I think it's very ethical to make it available to other countries where people are on a waiting list and they don't have sufficient. Basically, the availability of organs is a question of the political society and whether they are a so-called opt-in or opt-out. So in many countries, when you get your driving license, you're automatically in donor unless you subscribe you don't want for religious or any other reasons. That's the opt-in. So you're normally automatically in. And in many other countries, like in Germany, you should one day, by accident, by advertisement, come to the idea to be a donor and then fill the paperwork and have a so-called donor pass with you. It's like a kind of negative option. And this is why we have a lack of organs. And we have people on waiting lists. The majority of countries who change this are not really having long waiting lists because they have just way more organs available.
Hamadi, I visited you in Germany. At that time, I might have had coronavirus because I certainly contracted it by the time I got to Vietnam, which is why, again, I'm still in quarantine here. But I received my 4th negative test today, so I'm cured of coronavirus. Would you, Hamadi, take my corneas in case you needed them? Would you be willing to accept my corneas? Would you think that they're safe at this point?
That's a very good question. Theoretically, I would say yes. Even so, I don't want to have your corneas. I like you seeing me way more. And I'm happy that you recovered from COVID-19.
Yeah.
But it's a logic reply because up to now, there are first reports which tend to show the opposite. But up to now, we all believe once you have been in contact with your immune system with COVID-19, you have antibodies and you're more safe. So your corneas are probably more safer than anybody else because they've seen COVID-19, they've survived COVID-19. So maybe they might even protect me a little bit.
Hey, going back, I just thought of another question related to the corneal transplantation issue pertaining to COVID. But essentially, let's say you're a patient, right? You're in dire need of a transplant, let's say in the United States. It cannot be guaranteed at this time whether that transplant contains coronavirus, but you're going to go blind if you don't get it. Do you think it's worth it to take it and take the risk?
Reminds me a bit in the question you've been posing recently on LinkedIn with one of the medicaments which potentially help to fight coronavirus, but they might cause unrepairable damage to the retina. And then the question is, what is better?
Right.
Is it better being blind or is it better being deaf? Probably it is better being blind, but it's a poor choice. We should do everything to do both, to survive and keep our vision. That should be the aim. It's really bad to choose between the deep blue sea and the devil. That's not the choice we should be aiming for.